Hey everybody, this is Alan and Darlene Gonzalez, and we wanted to introduce ourselves as Darlene is an ER nurse, and she's been wanting to kind of create a YouTube channel around health and wellness, and we've finally kind of decided that we wanted to do something together, and we've got a lot of aspirations to create a business, and we kind of wanted to start it with YouTube and trying to help others understand, all things medical, wellness, all that good stuff. So, today we're going to kind of talk a little bit about the introduction of the new channel, and Darlene's going to talk a little bit more about her background and kind of what got her here and why she wants to do this. So, Darlene, what's the name of the channel, and what kind of inspired you to do this?
Well, I want it to be called Health and Wellness with Nurse Darlene. And the reason for it is because I feel like I have my master's in nursing education, and I feel like it's important for us to educate everybody. And sometimes nurses are so rushed when a patient leaves the hospital, they're not fully educated, so they have lots of questions. And that's what this channel is going to help with.
That's great. So why did you get into nursing?
Well, many years ago when my brother died, he died from what we thought was nurse error. And so I wanted to be able to save the world, and obviously, I can't, but I feel like one person at a time is where we're gonna, be able to help with at this point. It's not something you can do in masses, but with this form, I think it will help tremendously.
So when you were thinking about the channel, what were some of the things that kind of came to mind? What were some of the ideas and topics that you may want to share with people?
With the COVID-19 virus that's going around right now, I think it's really important for all of us to really know the truth. I work in an ER, I know what's going on, on the front lines. There's a lot of misnomers out there, and I think it's important for us to clarify. But we can go as simple as the common cold, stomach flu, you bumped your toe on something. Does that require running to the ER? A lot of times, no. All they're going to tell you to do is buddy tape it. So, there's many things that you guys, as the viewers, will want to talk about, and we'll be able to accommodate that.
Great. So, talk about the timing of this. You mentioned COVID-19 and other things. How important is the timing in what you're seeing in the industry now as to why you kind of wanted to do this now?
Well, because a lot of things need to be done online because of COVID-19. And with us, instead of going into the doctor and being exposed to the virus or something else, it's important for us to do this online so that you guys can get educated as much as you can without having to go into the doctor or paying a copay for telemedicine.
Right. Some of the goals of the channel, talk a little bit more about some of the goals and aspirations, kind of where do you see this going?
Well, I see it going as far as you want us to take it, to be honest. We can go into aesthetics, we can go into just basic health, we can go into nutrition, wellness. We can go into many ways, and I believe that what we can do is if we aren't fully knowledgeable on something that you guys want to talk about, we can have a guest speaker that day that is knowledgeable. We can have doctors, we can have nurse practitioners, etc.
Yeah, I know you talked a little bit about that, having guest speakers, having actual doctors, and that's kind of the big thing of when we decided to kind of do this and have aspirations of possibly opening up a clinic. The one thing is, Darlene is currently in school to become a nurse practitioner. And so part of the reason, coming to Arizona, there's a lot of things that a nurse practitioner can do here that they couldn't do in California. And that's where we probably think medical is going, the way of the nurse practitioner. So it's extremely important that I know you talked about really, helping others, helping people understand, navigate the waters, right?
Right. This is the goal for sure. We want to help you.
Yeah.
100%.
And that's the thing. As we kind of develop the channel, you'll see down in the in the notes, there'll be links to different things, topics that we'll be talking about, ways that you can get more information. And that's going to be extremely important, I think, going forward. So, you know, we're excited about this, right? I mean, it's super exciting to kind of do something. There's a lot of information out there. There's a lot of channels. There's a lot of nurses. But we really kind of want to help cut through all of that and really help you understand what's important, what's not important, what should you pay attention to, right?
Exactly.
Yeah.
Me, with my background in nursing education, I have my master's in nursing education. I've taught at the clinical level and I've taught at the school level with third semester nursing students. I've never felt so satisfied as I have when I've been able to educate a patient. So it's the patients that need the education before they go home so that they can be fully understanding of their disease that they were sent home with.
Yeah.
You don't have to always go into the ER. You don't always have to go in to see the doctor. And so there will be ways for you to prevent these visits. And we will talk about all those things.
Yeah, so there'll be a lot of things that we're going to tackle, from COVID-19 to medical aesthetics, and like you said, you know, bang your toe, should I go to the ER, whatever. I think it's going to be some really interesting topics, and like she said, you guys will help drive it. You know, we're going to be creating content. As we know, we've got a lot of episodes kind of pre-planned, but based on your notes, based on your comments, we can definitely bring on somebody to interview and help answer those questions. So, you know, it's we'll be having some videos coming forward, but remember to subscribe to our channel. You know, like as many likes as we can get to kind of start spreading the word. Don't forget to subscribe. Don't forget to hit that little notification bell, because that's when you'll start to get those notifications as to when we pop up a new episode. So we're excited. Can't wait.
Yep, can't wait. It's going to be a great time, and this is the perfect time for us to do this. So make sure you subscribe.
Yep, we'll be talking to you soon. Bye-bye.
Bye.